Welcome to the MS-Perspektive podcast, Perspective with a K as I'm German. I'm Nele von Horsten, MS patient, patient advocate and author. I'm bringing you interviews, inspiration and information about living with multiple sclerosis and show you ways how you can positively influence the disease and make the best out of your diagnosis. On ms-perspektive.com you will find the show notes, 11 free tips as a PDF and lots of other information. And now the show begins. Thanks for tuning in again and welcome to episode number 135. Let's talk about vaginal health and MS, what women should know with Dr. Melika Arab Bafrani. And now enjoy the interview. Hello Melika, it's such a pleasure to have you on the show. Thanks for being here.
Hello, dear Nele. Thanks for your time and your invitation. I hope it can be helpful, and I hope we have a nice meeting together and maybe helpful for the audience.
I'm pretty sure that will be helpful. So before we actually start, it would be lovely if you could introduce yourself to the audience so they know who is with me on the podcast today, your background in working with MS and patients, and something about you.
Of course, I'm Melika Arab. I'm a MD and PhD graduated from Tehran University of Medical Sciences, Tehran, Iran. And now it's about 11 months that I joined UCSF neurology department, and I'm working here on different projects related to women with MS. Our focus here is on different milestones and different complications that women with MS face during their pregnancy, postpartum, and their postmenopause. But my background will get back to the 3 years ago when I was in Iran, and I started my MS-related research under supervision of Dr. Sahrayan. At that area, our focus was on environmental risk factors and the incidence, prevalence, progression, and different factors that can affect the severity of population with MS.
Very interesting. Why is it important to talk about vaginal health in women with MS, even though it's often overlooked?
Talking about this area is so critical because at first focus on hidden risk of the treatment of MS is so important, and another aspects are try to improve the quality of life of a woman with MS, try to take care of their reproductive health and provide comprehensive care of this woman. This population have different milestones, including puberty, pregnancy, postpartum, premenopause, and postmenopause. They are half of population around the world, but their issues remained under shadow yet.
Yeah, unfortunately, we still have to, increase the speed, I guess, on that to come up to the same level as medicine is looking into men topics. Yeah. So what does current research suggest about how MS and disease-modifying therapies might affect vaginal health and the microbiome?
Different evidence suggests that both MS itself and the use of DMTs or disease-modifying therapies may influence the vaginal and broader genitourinary microbiome. MS is characterized by immune dysregulation, which may extend beyond the central nervous system and change mucosal immunity at other sites, including the vaginal environment. In other hand, some DMTs, particularly B-cell depleting therapies like ocrelizumab, rituximab, and ofatumumab, and different other immunosuppressive agents can lower protective immune surveillance and potentially predispose women to change in microbial composition. And in results, we will see higher risk of a vaginal or a urinary tract infection, UTI, and reduced microbial diversity.
Okay. What do you think? Why has this topic not received more attention until recently?
I can name several reasons to explain this, because at first we can say that historically MS research has focused predominantly in neurological outcomes and the efficacy of DMTs on relapse and disability and a progression, with less emphasis on systemic or reproductive related health effects. The female genital tract microbiome has only recently become a focus of investigation across medicine, across the other topics, and specialized studies in MS population requires targeted requirement, longitudinal sampling, and multidisciplinary collaboration, which were not previously prioritized in the investigation and studies.
Why is collaboration between neurologists and gynecologists so important for women with MS?
Honestly, a collaboration between neurologists and gynecologists is crucial and vital for women with MS, because DMTs used to treat MS and can impact gynecological health, leading to complications such as HPV-related cervical dysplasia, cancer, inflammatory vaginitis, infectious vaginitis, and herpes virus infections. Neurologists may not routinely address gynecological health, and patients may not associate symptoms with their MS treatment. By working together, maybe they can educate their patients about a preventive measure, emphasize on HPV vaccination, routine cervical cancer screening, including pap smear, and other kind of management of vaginal health. They can be ensure early detection and treatment. And of course, they can develop individualized treatment plans that can make balance between MS management with gynecological health consideration. Of course, this kind of multidisciplinary approach can enhance the well-being and quality of life of women with MS.
Yeah, okay. And yeah, I think an important thing is that all of us who have kids, no matter if they are boys or girls, should think about getting the vaccination on time on HPV, because it can really make a difference for at least that section in the future. And there was some nice news on, I think it was Scotland, and then my doctor here told me that they had even way earlier nice results in Australia, where HPV vaccination really made a difference, that there are not many or no new cases, because they are really taking care that everybody get vaccinated. So that is something we can do. Yeah. What can patients do if their neurologist doesn't ask about intimate health? Because for some, might it be they don't think about it, or they feel not, they don't feel good about asking the young patient sitting in front, or the older patient, female patient sitting in front of them?
Yeah, of course. At first, I can emphasize that this area, gynecological health, now is under more focus and emphasizes. For instance, in the last week in Extremes, we had a session about this. So it seems that all the neurologists will be aware of this domain and can help their patients better than before. But if your neurologist does not ask about other symptoms and your other aspects of health, patients can take some steps to ensure their concerns are addressed. At first, they can start the conversation, bring up any gynecological health concerns that they have during their appointments. They can seek guidelines, ask their neurologist about potential effects of MS treatments on gynecological health. They can ask the neurologist to refer them to a gynecologist and consult with a gynecologist, schedule a regular visit with him or her to discuss their concerns. And of course, they can educate themselves, learn about the risk associated with MS treatments such as HPV-related complications, different kind of vaginitis, symptoms, or herpes virus infections, and ask for advice on prevention and management.
Very good.
Taking these steps all together that can empower patients to address their concerns and minimize potential complications.
Okay, great. Thank you. Yeah, let's talk about what women should pay attention to. Are there any early signs of vaginal health problems women with MS should watch for?
Of course, at first, I can say it gets back to us. We should be aware sooner than our physician and sooner than our neurologist ask us. Women with MS should watch for some early signs of vaginal health problems, especially if they are on DMTs. I can name some of the signs and symptoms like abnormal discharge, any kind of change in color, odor, or vaginal discharge. You can be aware of any discomfortness or pain, any pelvic pain during urination or sexual activity, of course. Any kind of itching or irritation, redness, swelling in the vaginal area can be a sign of some upcoming problems. Of course, any kind of unusual bleeding, spotting, or bleeding outside of normal menstrual cycles can be a red flag for some problems that they should be under focus emergently. And recurring infections, frequent yeast infection, bacterial vaginosis, or other kind of vaginal infection could be under focus. And at the end, maybe ulceration or some lesion that can be painful or painless could indicate conditions like pyoderma gangrenosum or herpes virus. It's so rare for them to start with ulceration or lesion, but we should be aware. If any of these symptoms occur, women should consult their gynecologist or primary care provider soon for evaluating and treatment. Early recognition and intervention can help prevent complications and improve overall health.
Great, fantastic. Okay, that is being active when something happens. Now let's come to the preventive side. What can MS patients do today to support their intimate health? Are there any daily habits or preventive tips you can give to the audience?
MS is a chronic autoinflammatory disease and will be with any patient for whole of the life. So there are some points that needs your attention. At first, like other parts of your body, maintain good hygiene. Practice regular and gentle vaginal hygiene using every product to avoid irritation. And second, stay hydrated. Drink plenty of water to support overall health, prevent dryness, and prevent a suitable environment for the microbes to grow. Next, healthy diet. Consume a balanced diet rich in probiotics, but keep in your mind that eating probiotics, prebiotics, tablets are not necessary for us or for no MS patients without the advice from your neurologist, because a lot of marketing are there in this area and try to trigger us to go to the side of prebiotics and probiotics consumption, but we don't need this. We just need to consume a balanced diet rich. Avoid smoking, have a safe sexual practice, try to use protection during sexual activity to reduce the risk of sexually transmitted infections. Have your regular checkups, please. Schedule routine visits with the gynecologists for screening like pap smears and HPV testing. There are some more attention for pap smears and HPV testing for a woman with MS that are on B-cell depleting therapy or other DMTs because they are in the category of immunosuppressant people. So maybe some of them needs to more frequent pap smears after 35. So be aware of the new guidelines and try to ask your neurologist to check the last and updated guidelines. Consider HPV vaccination and pay attention that this kind of HPV vaccination can help you and reduce the risk of cervical dysplasia and different kind of cancers. Try to manage your stress, monitor your symptoms, and be aware of any change in your body. And at the end, try to take care of your body and your mind in parallel. And don't be stressful on this area.
Yeah, sounds good. I guess even though you did a lot of research and other people's as well, there are still some open questions. So what are the biggest gaps in our knowledge, and why is more research into vaginal health in MS needed?
As long as we go through this area, we find that there are a lot of gaps in this area because women have different kind of milestones, different kind of change in the hormone balance, and it makes their body so different in each age decade of their life. But the biggest gaps in our knowledge regarding vaginal health in MS until now includes at first impact of DMTs on vaginal microbiome. There are limited understanding of how these DMTs affect the vaginal microbiome and mucosal immunity. Next, mechanism of gynecological complications. Insufficient research on the mechanisms by which DMTs contribute to conditions like HPV persistence, cervical dysplasia, inflammatory vaginitis, and herpes virus infections. There are some questions about long-term risks of these DMTs, maybe after 20 years of using ocrelizumab,
Mhm.
how your body will face it. Another question is diagnostic neglect. Disabled women with MS may be underrepresented in cancer prevention programs, resulting in missed opportunities for early detection and intervention. And the result of different studies shows this point that maybe people with higher EDSS and higher disability have a more risk and odds ratio of cancer, and it's not exactly related to the MS. It's because they are disabled to provide and take care of themselves and follow the screening. And another important question is about maternal fetal implication, because there are limited research on how MS-related immunosuppression and vaginal microbiome change might affect maternal and neonatal health. Maybe at this time we know that the mothers with MS have the same chance to have the healthy baby to become pregnant, but we should follow up their children for maybe 10 years, 20 years, and 30 years to find out that is all the risks as the same or not.
Yeah, I'm actually taking part in such a study here in Germany, led by Professor Hellwig. I guess you know her name. But I was only starting with the second child, so she is now 1.5 years. This will take a little bit until there is some outcome, but yeah, they are doing a great job. How could this research shape future, more personalized treatment options? What do you think?
Of course, personalized medicine is clue and the key of the future medicine. And I can make this a story that if we find a connection between a specific kind of microbiome that is more responsive to any kind of DMTs, or it's not responsive to any kind of DMTs, so we can hopefully and make sure that it's the best treatment for our patient, or maybe we can surely say that it's the worst one. In some patients, we will see that they have a lot of adverse events and reactions for some drugs and treatments, and for other patients, we see that they have no reaction and everything is normal for them. And the research say that maybe it can get back to the gut microbiota, to the vaginal microbiota, to the any other personalized medicine factors that can be under more focus in the future. I think that the most important goal for us is this: to find which DMT is better, maybe for this race, maybe for a start in this age decade, a start in this kind of people or not. Yeah, it's the place that we should trust to the personalized medicine.
Sounds good. And in order to reach that goal, I think we should also talk about why women with MS should consider participating in research studies on this topic.
Uh, at first, it's who can help us other than ourselves. I can say this, and this area is under a lot of unknown knowledge, finding and current data on how DMTs affect gynecological health are very limited. There is a very big lack of mechanistic studies, particularly regarding the effects of DMTs on vaginal microbiome. So participation in this area helps generate data for ourselves at first, to improve their reproductive and maternal health, to improve and enhance clinical trials and practice, and its direct benefits for patient. I can remember that we have one patient that she had her first baby in 2017, 2017 to 2018, I'm not sure, and she was user of Ocrevus at that time, and that time the data told that you shouldn't breastfeed while you are on Ocrevus before your conception and your delivery. But she had her second baby in 2024, and the trial that she was a part of that, a participant of that, had this result that it's no worry, you can continue breastfeeding. And it was so nice moment for me when I talked with this mother, and she told I saw exactly the direct benefit of this clinical trial on myself.
Fantastic. Yeah, that's really a nice story to share. Thank you for that. What you what would you say to someone who's unsure or nervous about being part of a study?
At first, I advise her try to ask someone who is coordinator of one study. Ask her about the benefits, about the adverse events, about the cost, and about when the result will be published, and try to involve with the question to make sure that this study has no bad impact on your health, does not change your treatment. Of course, I think that our patients, when make sure about there is no dangerous for them, can be more comfortable to participate in the different studies and have this in their mind. It's a seed that you will plant, and maybe you can sit down under its shadow.
Do you think future MS therapies should consider vaginal health and the female microbiome as a factor?
Yeah, I think, but we need a lot of more data and more trials, more genomic and bioinformatic study to can say yes, but I think so.
Fantastic. And could this research one day change how MS is treated in women?
Not totally change the treatment, but maybe some diversion, maybe some change in the total time, the kind of infusion, maybe try to pay attention to some factors that can help them during their treatment to experience less adverse events.
Mhm. Let's come to the quickfire Q&A sessions. Complete the sentence. For me, multiple sclerosis is?
Multiple sclerosis is the place that your body fights against itself, and you should be more kind to your body to stop it from this fight.
Mhm. What development would you like to see in the field of multiple sclerosis in the next 5 years?
Of course, I see a lot of young women that they are so anxious about their family planning, about their baby caring, about their job, their career. And I hope that we can do something to help them to be more comfortable with this disease, because it's a chronic disease and there is no way to pass away of it. So I hope that our patients try to be more comfortable with disease and say one day that their MS is done. Yeah.
Would be lovely, yes. But feeling informed can already help to feel more relaxed, I think. At least that was a case for me, and I think for many others. So we are coming near to the end. If someone wants to bring up this topic with a doctor but feels hesitant, what's your advice?
Of course, I think that you can start this conversation that I heard about this topic in not social media, in this document, in this article. I'm planning to I'm planning to have a baby. I want to be more comfortable with this disease. I'm a bit stressful for that. I'm sure that the neurologists around the world are welcome to hear about the signs and symptoms and want to take care of their patients at the best time, at the best way.
Yeah, I think so too. What message would you like to leave with women who may not have considered this part of their MS care?
Uh, please, please, please be aware of the symptoms. We can say, based on the work of in different clinics, I can say that more than 75% of women will experience one of the symptoms that we mentioned, but they try to ignore this. They try to connect this to their diet, their sexual activity, their stress. But be aware that one symptom and pay attention to one symptom can prevent different challenge like cancer, infection, and vaginitis.
Mhm. Very important, yes. Melika, how and where can interested people follow your research activities? Because I think you will do more on that topic.
Yeah, of course. We will try to announce our trials and the result of our publications in LinkedIn and in the Google Scholar, but I think that we have one link in our lab with Dr. Riley Bobe, which we try to announce about the result of our publication. So in summary, I think the LinkedIn is the good pathway. I will try to update it more and better. Yeah. And I think that it will be helpful for the patients and for other audience that are interested in this topic.
Fantastic. Thank you very much. And of course, to everybody who is involved in that topic, thanks for for giving us some insights into it. And of course, good luck with all the research coming in the future. And hi to lovely San Francisco.
Thanks. Have a good time, and please feel free if you have any question, and please feel free for all of our audience if they had any question. I'm okay to answer in the LinkedIn, and I can share my email too if you need it, or if you prefer any better social media for that.
Fantastic. That's great. So I will put it in the show notes and in the blog article. And that's really great. Fantastic. Thank you very much. Bye-bye.
Of course. Thank you. Bye-bye.
I hope you enjoyed the interview, learned something new, and are aware now of the fact how important vaginal health is and what you should look out for. And by the way, next time there will be another Actrum special, and I have quite some interesting different presentation. I was looking live when the event was taking place, so I still have to make my mind up which one I will bring into the next podcast episode, but it will be an interesting topic, that's for sure. So please tune in again. Let other people know who might not know the podcast yet that it is existing, and rate the podcast wherever you are listening to it. And of course, let me know if you are missing certain topics. And otherwise, stay as positive and healthy as possible. And see you next time. Bye. Thank you for listening today. I hope you found it helpful. You may also be interested in the previously published episodes and posts, which you can find at ms-perspektive.com/podcast. Perspective with a K. You can also get a free PDF with 11 tips for your positive impact on MS at ms-perspektive.com/newsletter. If you'd like to get in touch, you can reach me at nele@ms-perspektive.com or on social media. See you next time.